okay. We prescribe something, they'll say okay. You take Snehapana, okay. So I was not having any difficulty prescribing some therapy. But when it came to my own practice, when I say I'll do Panchakarma, you have to take Vamana Virechana. So then I have to start from the history, details. They will ask 100 questions. What is Vamana? What is the effect? Why should I take Vamana? Why don't you prescribe some medicine? I can't come every day to your clinic. I can't spend that much amount of money. Like that. Okay? So it is very important for us to become better communicators. We need to explain things in a better way so that people will understand. After some time, you will get faith. People will have faith. People will be referred by patients who already got cured, and they will not ask so many questions. When I started my own hospital in 2005, I was young, right? So, like, people were like, he's a small guy, young guy. What will he do? He's asking so much money. He is saying so many things. He's saying he'll burn my skin, Agni Karma. He'll make me vomit. He'll make me go lose motions for 30 times. He'll use leeches and suck my blood. He'll push something in my anus. What is this rubbish? Can't he just give me some medicine, prescription? So, we need to create confidence in the minds of patient that this guy knows what he is doing. This guy is having experience, and what he speaks makes sense. Okay? So for that, what I did was, like, while I was doing my MD, everyone used to like my presentations, my PPTs. So whatever, my thesis was in Kafaja Unmada with special reference to depressive disorders, Brahmyadivarti Nasya and Lashanadigrata Pana. So in my thesis also, Kafaja Unmada, so depressed people. Actually, I wanted to take Vamana Karma as my thesis, but unfortunately, my guide and others, they were not ready to guide me. They were not ready because they have to help me. They have to come early in the morning. They have to do all those things. Why Vamana Karma? No, you take some medicine. But luckily, what I did in my MD was, I gave an ad in newspapers, Inadu, Andhra Jyoti and all Telugu newspapers. I gave ad. But no, permanent solution to depression, like that, by government doctors, free of cost. All those things I have written in the ad. And after 12:30, our OP was over. So it used to be over by 12:30. After that, I used to wear an apron and sit in the OP. And patients used to come. And adjacent to our hospital in Hyderabad, ESI hospital, there is this Yarragada hospital. So most of the people are, psychiatric patients. So they used to come there. I used to sit as a doctor, and I used to write Vamana Karma. We will do Vamana Karma, then we will do Nasya and all. And many people came, and many people were using antidepressants and so many psychiatric medicines. And after Vamana, after this Brahmyadivarti Nasya, we were able to stop these antidepressants. But I was a student then. Still, I was able to explain and convince the patient for Vamana Karma. Right? So today, what I will do is, suppose you are my patient with a severe disc problem, okay, disc herniation, and doctor has suggested you to go for surgery, discectomy. Then you are afraid of surgery. Until then, they will not come to Ayurveda doctor. When he suggests discectomy, then they will think about alternative. Is there any other thing? Then they will come. Sir, doctor has suggested surgery. Is there anything to postpone the surgery? That is what they ask us. Is there anything to postpone the surgery? Maybe after 5 years I will go for surgery. I am afraid now. So if such patient comes, how I will deal, how I will explain, how I will convince them for a 2 months panchakarma therapy, how I will convince them to pay 1 lakh rupees to me. Most of the time they will not get insurance. If they go for surgery, it will be free of cost. In this village, I have treated more than 100 patients, not this particular village, so many villages around this place. More than 100 patients got treated with severe disc prolapse. In Arogyashri, they will get free of cost surgery. But doctor says after surgery, you should not even lift 5 kilos of weight. They are all working in fields, agriculture, farmers or laborers. So they can't afford to lose their livelihood. They come to me, I treat them. So how I convince them? How I convince them to pay that much money, spend so much time, do so many difficult therapies? That I will show you. Okay? So, for every disease, I have a PPT. Okay? So, I will spend around 5 to 10 minutes and I show them the PPT. I'll make them understand that whatever he is speaking makes sense. He knows something. Maybe we can put some money and time under his care. So I tell them that the spine, human being, only creature who is having an erect spine. All other. So the most painful condition a person could possibly experience in his life, this neuralgia, disc prolapse, or any nerve compression pain. So all other animals, they are horizontal on their forelimbs. The spine is, upright only in human beings. The weight is being distributed uniformly in animals, but in human beings, the weight is getting concentrated in the lower back region. And I tell them, your spine is not a single bone. There are around 33 bones. So each bone is having a hole in it. It is like a bead. In Telugu, we call it Vennupusa. So there are 33 bones. And through the bones, the spinal cord is going like a thread through the beads. Then from the spinal cord, a pair of nerves are coming outside. So 31 pairs of nerves are coming outside. And just the place where the nerves are coming outside, there is this intervertebral disc. So disc is between two bones. And this disc is also a part of the skeletal system, but it is not bone. It is having liquid. 80% of that is filled with liquid. So because of this liquid, it is acting like a shock absorber. So if you are lifting some weights, bending forward, or traveling on a jerky road, then one bone tends to hit another bone and the disc in between is like a shock absorber. So when the liquid is enough, there will be shock absorbing action. When the bone is coming and touching another bone, the disc will send it back to its own position. But when the liquid gets degenerated, then there will be, the disc gets compressed, and when it is more compressed, it comes out of its place. Just like when you keep jam between two bread slices and press it, jam comes out. Similarly, when two bones compress the disc comes out of its own place. So see, this is the normal disc. Here the disc is pressing the spinal cord. So through the hole the spinal cord is going and disc is coming out of its place and it's compressing the spinal cord. So when they see this picture, they will understand. Until then they don't know. They will go to 5-6 doctors, they all will suggest surgery, but they don't know what exactly is their problem. So when we show this picture, they will understand, oh, the disc is compressing my spinal cord. And we show the actual photograph. This is the bone, this is the bone, this is the cartilage, this is the spinal cord. The disc is supposed to be till here only, it is coming out of its place and it is compressing the spinal cord. So this they can understand. Their MRI I'll show. Keep it in this thing and I'll show. See, similar to your MRI, this disc is white in color, mostly healthy. This disc is black in color, degenerated, and it came out of its place and compressing the spinal cord. So brain, continuation is spinal cord, disc is compressing, and you are having the problem either in the lower back or in the neck region. So similarly, and I have told him now 31 pairs of nerves are coming. Some nerves will come from the neck, they go into the hand, into the head, into the eye, from the lower back region to the thighs, to the legs, to the fingers. So wherever this nerve, when it is coming out of its place, the disc will compress the nerve, and wherever the nerve is going, you will feel the pain, you will feel the numbness, you will feel burning sensation, all the pulling pain and all those things. And they will easily, yes sir. When I show this picture, they will say, yes sir, like this only I am getting pain. Someone will say like this, sir, till the fingers I am getting pain. They will easily identify, yes sir, like that only I am getting pain. So when we show this, they will understand that we understand their pain. Okay? So similarly, when the nerve which is coming out of the neck, it is coming into the hand, then there is the compression here, the whole hand will they will be pulling pain and all. Sometimes the nerve goes into the head and you will get headache. Sometimes the nerve which is innervating the eye, that gets compressed. Then severe pain in the eye. Patient will say, I want to take a knife and remove my eye. That much pain is there in my eye, they say. Problem is here. They go to ophthalmologist, they go to neurologist. The problem is here. So we tell them, if the problem gets cleared here, all the other problems in your parts of the body will get cleared. So I will show them, this is your healthy disc. This is a degenerated disc. Because of the compression, the disc is coming out of its place. Then because of this, sometimes even the liquid also comes out of its place. Space between the bones, it gets reduced, and the bone also gets degenerated. These are different stages, I tell them. And when you were having little pain, you never came to us. If you come to us when you are having little pain, you will never need even panchakarma also. We will reverse it at the time only. Because now you are in this state, you have to undergo panchakarma. If you don't undergo panchakarma, the only alternative what allopathic doctor says is surgery. Then we have to make them understand the complications of surgery. We tell them, if you go for surgery, they'll remove your disc and fix some plates with screws. Like this. If they fix it like that, there will be no movement between these bones. You will not be able to bend like this, bend like this. Your movements will be restricted. Of course, some people will go for surgery even though they know that the movements will be restricted because they are unable to bear the pain. But this surgery is complicated. When we are cutting and removing the disc, if you are cutting the nerve, it can paralyze your leg permanently. Sometimes it might cause death also. It's very complicated. But if you get a very good doctor and by the help of Almighty, there were no complications. There are no complications of surgery. Even then, even if there are no complications also, they will remove 1 or 2 discs, maximum 1 or 2 discs. But the degeneration will show in the MRI. See, your degeneration is there in all the discs. Only 2-3 discs came out, but other discs are also getting degenerated. And the cartilage is not just there in your back or neck. It is also there in your shoulder, shoulder joint, in your knee, elbow joint, in your knee joint, in your hip joint, in every joint, even between 2 joints also, there is degeneration. Once the degeneration starts, the degeneration can happen anywhere in the body. So it's not like you remove these 2 discs, your problem will be solved permanently. These two discs are having prolapse because they are the last discs. Entire weight is on them. You remove them. Who will take the weight? The next disc will take weight. Then it will also come out. Then again you have to go for surgery. How many times you will go for surgery? If there is degeneration in the knee, again you have to go for surgery. Degeneration in the hip, again you have to go for surgery. So should you stop the degeneration and reverse it, or you go on cutting wherever there is degeneration? What is your choice? We will ask. Obviously patient will say, no, I want to stop the degeneration, I want to reverse the degeneration. So then you have to understand why this degeneration is happening. So why is this happening? Because of the free radicals. Just like you keep an iron rod outside, it gets rusted, oxidation happens. Similarly, when there are free radicals inside your body, oxidation happens, and your bones, your cartilage, all these things are getting degenerated. They will ask, why are these free radicals getting produced? These are called endotoxins. So endotoxins means toxins which are getting produced inside our own body. Why are they getting produced? Then we'll tell them, because you are not sleeping in time, you are not getting up in time, you are not eating in time, you are not doing any physical activity, you are not exposing your body to sunlight, you are undergoing a lot of mental stress, anger, worry, tension, depression, all these things. And also you are exposing yourself to pollution, unhealthy food, unhealthy thoughts. All these things are producing free radicals inside the body, and these free radicals are not allowing the nutrients from your food to reach your skeletal system. That is the reason why your skeletal system is getting degenerated. So unless and until we remove these free radicals from each and every cell of the body, the degeneration will not stop. Today, your disc in your lower back got degenerated. Tomorrow, in your cervical region, it will get degenerated. Tomorrow, knee, next day, hip, everywhere the degeneration will happen. Same process. Then they will ask what to do. Then we'll say, to remove these free radicals, we will do panchakarma first. So, we'll say, no dangerous surgeries, no harmful painkillers, and no recurrence in future. So we can assure them. So for detoxification, if the patient is fit, we will do both Vamana and Virechana. If the patient is, otherwise only Virechana. We'll tell them each and every cell, we will remove toxins. Some people say, in yoga we underwent Vamana Dhoti, Sankha Prakshalana. Okay, but these are much subtle, much deeper. You will just drink salt water and vomit, it will clean only your stomach. But Vamana will clean each and every cell of the body. Virechana will clean each and every cell of the body. We will tell them the mechanism also. So after removing these toxins, the degeneration will stop. But already there is degeneration. Already there are bones which got degenerated. What will we do for that? We will do regenerative therapies. So for regenerating, we will do Vasti. We will do Nasya. There are some wonderful therapies like Erandamula Divasya and many other Vastis which will regenerate the cartilage, regenerate the liquid. I have so many patients where their MRIs have shown after the therapy, after 6 months, after 1 year, the disc comes back into its place. So that level regeneration will happen. We will assure them. I will give phone numbers of my old patients and ask them to speak with them. In 2005, 2006, I have treated so many patients. And today, when I give their numbers after 20 years, when they say that I am absolutely fine, these patients will get confidence. Only for those people who are still reluctant to join, we will give phone numbers also. These are different levels of, management. These are not regenerative therapies. These are helpful therapies, supporting therapies, but the actual regeneration happens from Basti. So then the patient will ask, what will they ask? Is regeneration possible? Normally they say that once it is degenerated, it is degenerated. You have to cut and remove and replace. Is it possible? Regeneration is possible. That is what they ask. Then how do we convince them? Ayurveda, regeneration is possible. Rasayana is what is, today's 5th. Tomorrow, Dr. Setu Madhavan sir is coming. He is doing this Kuti Praveshika Rasayana, Kayakalpa Chikitsa. So 1 year inside the Kuti. Okay? And a old man is going inside and a young man is coming outside. Like that he is doing the treatments. And he will share the secrets of this thing. So someone told me in Kerala, they train the elephant in a specific way. When the elephant is baby elephant, they tie it with a rope. Okay. And because it is a baby elephant, it will not be able to free itself. And they train it continuously. And when it becomes a big elephant, Mother Gaja, even if you chain it with chains, iron chains, and tie it to a huge vriksha, Mahavriksha, either it will uproot the vriksha or it will break the chains. But if you tie it with the old childhood rope with which it got trained, it will not move an inch. Why? It got preconditioned in its mind that if I get tied with this particular rope, I will not be able to move. It got fixed. Okay? Similarly, the inputs we get from the society, they say that once your bone is degenerated, you have to replace, no other way. Doctors told the same thing. Everyone is telling the same thing. Friends will tell, "Arey, you have a disc problem, go for surgery. You have insurance? Yes, okay, go for surgery." So this is what they are saying. People think that, oh, once there is degeneration, I have to replace it. There is no way I can regenerate. This is what people are thinking. It is ingrained in their mind. So body is also not regenerating the discs. So we need to put that thought that regeneration is possible. How do we tell them? We need to explain it. See, this is not the alone. They did an experiment. There was a huge aquarium, and in between the aquarium, they have placed a glass slab partition which is transparent, and they have filled it with water. And one side they have kept white color fishes, and another side they have kept black color fishes. And these fishes tried to cross. They came in between, and when they hit the glass slab, they went back. After a month, they have removed the partition. After a month, they removed the partition, but the white color fishes are on the white side, and the black color fishes are on this side, and they never cross. They are coming till that place and they are going back. Coming till that place and going back. Why? Because in mind they got fixed that I can't cross this. So mentally, if you are tuned that you can't do anything for yourself, your health is not in your hands, it is outsourced to doctors. You will not be able to do anything on yourself. This is what people are thinking about themselves. But Ayurveda says, Swastha Vritta, your health is in your hands. And of course, we will give little help also for them to regenerate. Okay, how we will tell them, explain them, we'll tell them that human body is like a flowing river.